you ought to be seeing it twice as often as neurofibromatosis. But it's one of those iceberg syndromes, so only the very tip of the iceberg is going to be evident. You use that analogy as well. And so you may be going to see 1/100th or 1/10th of the cases, because most people are going to be healthy, they're going to be leading normal lives, and they don't come to medical attention. So there is no easy answer to how often you see these patients and how often do they walk through the door. I have probably 40 families in a city of 1 million people. And I know that there are going to be people out there because I actually know people in my own personal environment whom I think have Noonan syndrome. I see people walking through the hospital that I know we've never seen who I'm sure have Noonan syndrome. And so you're just under ascertained.
The ones that they come to you, why? What is the most important presentation?
Right, so if you think about those cardinal features, some will come because of their heart, and that's probably going to be the earliest presentation because a lot of that is congenital structural defects or very early onset hypertrophic cardiomyopathy. Some are going to come to you just like in Turner syndrome because they're small.
Learning disability.
Or
learning disability.
Well, that would be the other reason,
Yeah.
but I mean, some will come just because they're small, and they'll come particularly around the time of puberty, which is where their height appears to fall off because they're not going through the growth spurt that everybody else is. Some will come because of intellectual handicap, but in Noonan syndrome, that's going to be a small percentage.
And some came as adult for menage. They didn't get the video, so infertility.
Although that's very uncommon as well. So
sometimes go to the neurology clinic and they
they reach 40 years and they didn't get the video, so they came.
no, I understand that, but that will be very